Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just tuning in, we are talking fatty liver disease. Joining me in studio is ExpressCare's Dr. Jitka Lom. Let's take some viewers' questions. Okay, so a viewer is asking, is fatty liver condition a condition that comes over a long period of time? We discussed a little bit about that.
Yes, it really does. It tends to occur in people's 40s and up in middle age. But yes, it's a lifestyle disease that comes over many years of overindulging.
Okay. Another viewer asks if fatty liver disease is hereditary, as many diseases here are.
Yes. The tendency towards liver to storage diseases like this, it does tend to run in families. So, there isn't, as far as I know, a genetic marker for it, meaning you can't do a blood test or something like that to identify whether you have the disease. But it does tend to run in families, and it's extremely common.
Okay. Now, is it more common with males versus females?
Yes. It depends a little bit on the age group. It tends to be that women will respond worse to sugar, men will respond worse to the fats in their diet. So it will divide up that way. As far as I know, there's no difference on Guam between male and female.
Okay. Now, another viewer asks for fatty liver. Can it be resolved permanently with diet, or is it a temporary correction?
Oh, excellent question. You can really affect your liver health by what you put in your mouth. As far as dieting, or the key here would be weight loss and using up some of your fat stores through exercise and drinking water, avoiding alcohol, and all the healthy things that we always talk about here, including the high fiber and all of that. But you can also help yourself with supplements, which you can get at a vitamin store, which the name of the supplement that will help your liver, whatever your liver disease, is called milk thistle extract. And the ingredient there is silmarin. And milk thistle has nothing to do with milk. It's a type of plant, a thistle. And the herb helps to purify your liver, and it will help it work better. And I've seen it many, many times where somebody has moderately severe liver disease. They go on the milk thistle every day. It's completely harmless and has no side effect for most people, and it will help their numbers come back down to normal. So that's a completely harmless thing that you can do to help yourself if you have any kind of liver condition, and it's readily available over the counter. But your question as far as is this permanent, if you adopt a permanently healthy lifestyle, hopefully your liver will stay permanently healthy.
Okay. Now, another viewer asks, is there such a thing as non-alcoholic fatty liver?
Yes, that's exactly what we've been talking about from the diet. So fatty liver can be either from too much alcohol, or too much of the sugar and fats in your diet, obesity, or from a combination. So you can have both of those factors cooperate to give you the disease. But yes, that's the one we're talking about, is non-alcoholic fatty. Steatosis is the name of fatty liver in medical speak.
Okay. Are there other factors that may influence your chances of developing alcoholic fatty liver disease?
Sure. If you, for example, had any other liver problems, such as over in the past you've had hepatitis A or B or C, if you have a disease on Guam that's relatively common called hemochromatosis, that's iron storage disease, if you have any other liver condition and you drink alcohol, it is going to make it worse, because alcohol is a toxin that is processed through the liver. Remember, the function of the liver is to detoxify our blood. So when we put a toxin such as alcohol in our blood, it has to go through the liver to clean the blood. And so that is why we want to avoid those type of products. There are other substances that are environmental toxins. Some of the pesticides and so on can also travel through the liver and harm it.
Okay. Now, what is the difference between the symptoms of a non-alcoholic fatty liver and an alcoholic fatty liver?
Also an excellent question. With alcoholic fatty liver, it kind of depends on whether the person is constantly drinking small amounts of alcohol over time. They don't really have binges. They just kind of keep on adding it on, and they're just a steady drinker, let's say. Over time, they will develop a fatty liver that over time will develop probably into inflammation and what we call basically cirrhosis, where the liver is completely scarred up and doesn't work at all. Now, if they're a binge drinker, a different situation can happen where it's a sudden huge load of alcohol. Now this can happen, for example, with teenagers, or sometimes military recruits, or situations like that. Used to be college students, huge load of alcohol suddenly going through a liver that is pretty naive to alcohol, hasn't really seen a lot of alcohol over the years. Now this big giant toxic load goes through there and can cause an acute hepatitis. Now the person has severe pain, swelling of the liver, vomiting, can go into a coma, can actually die. And that is one of the tragedies that sometimes happens when young people overindulge.
All right, thank you so much, Doc.
You're welcome.
Well, next week we'll be talking about the ins and outs of TB skin testing. We'll be back